Hey guys, welcome back. We are the Carmack family, and this is our long-awaited birth story of our beautiful quadruplets. It's a pretty crazy one.
If you haven't, go back, check out the other videos. We're going to put it in the description. Where we left off was Hannah is mid-nasty burger.
It's nasty.
Gray in color, hospital grade burger.
I can honestly say that I did not end up with food poisoning. I wish I had a photo to show y'all what this burger looked like, because looking back now, I probably would have never even thought about eating it. But I was just so hungry, and it was the best thing.
So Hannah's eating this burger, and then a nurse comes in, the one that told her that she could eat it in the first place, frantically comes in and says, "Stop eating that burger. Don't eat any more of the burger." And we're like, "Oh, okay."
He's like having a panic attack.
Yeah,
y'all.
he's having a panic attack. Did not comfort us at all.
At that point, he leaves, and within about like 5-10 minutes, Dr. Cozy comes in, which was really amazing, like totally a God thing, just because she had been with us our entire pregnancy. And so it comforted me to know that, like, hey, if I go into labor, she gonna be there.
Yeah, it's really wild, because in the Women and Infant Center, you have so many doctors. There's like 50 different doctors that they rotate. And for a doctor that had been dealing with us the entire time to be on call the night of Hannah delivering, it was awesome. It was a lot of comfort. We felt completely safe and comfortable with her.
And she says that 2 of the Dopplers are reading the same exact heart rate, which is not normal. She decided that she wanted to do another vaginal check on me, and mind you, at midnight, she had already done one on me, and I was reading 2 centimeters at that time. And so she had already warned me that if I kept dilating, that we would have to be rushed to emergency C-section. And so she starts doing her vaginal check, y'all, and she starts being super frantic, and she's like, "Hannah, you're 4 centimeters and 75 effective. We gotta go." And I'm telling you, like that, y'all, they were rushed in.
Yes.
Started doing their stuff to prep me. Michael's like, I don't even know what he's doing. I just remember telling him, "I need you to call my grandmother. Tell my grandmother that I'm going into labor."
Yes.
Because my grandmother was up, and she was asking like how things were going, and I was like, "I don't even care. You tell her right now."
I went from street clothes to totally scrubbed out. I'm talking about head cap. I'm bald, so I don't know what they was thinking. But I had a lot going on all of a sudden, and we had her on a gurney headed out.
Yeah, it was a lot. Like, it probably only took them about 5 minutes.
It didn't take long at all. They had her prepped and ready to go. They told me, like, "Hey, we're gonna get her back there. We've got this little waiting room right outside the OR. You go wait in there."
Is it OR?
The OR. They were gonna tell me to wait there. They said, "Hey, we're gonna start our epidural, and then we're gonna call you back, and so you could be there for the birth of your kids." And we're all excited. All I could think to do was start praying. So I start praying, and then nurse.
Didn't you put a message on Facebook saying she's gone into labor?
I did. I let everybody know, like a good husband would. But a nurse comes in that worked ER when Hannah went in a couple times. Like, every time we went to the ER part of Women and Infant Center, she was there. And so she kind of knew us and was excited about the babies. And so she stops in and she's like, "Hey, everything's gonna be okay. You know, this is awesome. Aren't you excited?" And I remember when they brought me back there, they said it was gonna be about 15 minutes. This is about 30 minutes later. And the nurse that we knew from ER, she was like, "Hey, I'm sure everything's fine." And then nurses behind her start running to the OR. And so the ER nurse looks back at me and is like, "Everything's fine, I'm sure." And she said, "They shouldn't be running. Nobody's allowed to run in an ER because people will panic." And here I am, I'm about to panic, because I know that right behind those doors is the OR that my wife's in, and people are running frantically to the OR, and there's some sort of emergency, and it's supposed to be 15 minutes, and now we're at 30, and I'm trying to figure out what's going on, and come to find out, Hannah was struggling.
They get me back there, and y'all, I hate epidurals. Like, I hate anything that has to involve my back because I've had a back surgery before, and so I'm like a little bit more cautious than most people. But luckily, I had the same nurse with me that was there from the time that I got checked in that morning, or the morning before, because now we're into another day. And so, you know, they're already like prepping up all of these people inside the OR, because there was probably about 40 different people at this time in there. I had like 3 nurses that were prepping me for the epidural. I had the anesthesiologist that was asking me all these questions, and I was like in shock, I feel like, because there was just a lot going on, and I was not expecting to have the babies that soon. Like, I thought that I would have time to like mentally prepare myself, but even now thinking, I don't think I could have been prepared anyways, because like I'm about to give birth to 4 babies, literally. Finally, they did the epidural, and that's when things got really crazy. And then they laid me back for it to take, and as soon as they did that, I instantly felt like I could not breathe. And it wasn't even like anxiety, like I physically, mentally, everything could not breathe. And so I like start tapping my nurse, and I'm like trying to mouth to her that like I can't breathe. I think that's whenever the anesthesiologist realized that something was going on. And so he put a gas mask over my face, and then all of a sudden I remember hearing this woman talk to me saying, "Hannah, are you having a panic attack? Are you panicking? Like, are you okay?" And in my mind, I'm like, I can't talk. Like, I'm literally numb everywhere. I can't talk. There's a gas mask on me, and like, I feel like I'm about to die.
At this point, they bring me back finally. As I'm walking through, so they take me through these doors, and they tell me that we're gonna have to go the back way. And because there's a lot of people in there, and so they're bringing me through this really skinny hallway, and there's a lot going on the right side, like there's sinks and all kind of things, but I remember it being really skinny. And then I see them cart a baby past me, so I'm like, that's one of my babies. And so they bring me to Hannah. Hannah looked like she was in really rough shape. Like, she didn't know where she was at. They told me what had happened. So they explained to me that her epidural went too high and it numbed her esophagus, and she felt like she couldn't breathe. I remember when I was in that room, so there was a curtain and I couldn't see anything past that curtain. So I was just at Hannah's face, and I felt like there was a world behind that curtain. Like, I felt like it was a whole football field from me to the other end of that curtain. I don't know why I felt like that either, because maybe it was just so many people in the room, but I felt like the babies were so far away. So next they pull out David. I see them cart him by, and he looked good. He was crying when he came out, and I just remember in awe of just how small these babies were. I'd never seen anything like that. It was really scary. It was really awesome. There's a lot of feelings. A lot of feelings going on right there. Hannah didn't see not one baby.
I don't.
Not one baby when
I
they came
can't
out.
tell you, I was aware of the babies crying.
Yeah, so they pulled Daniel out.
But
He's
I don't
crying.
know what else was going on.
So I feel good about that. I'm like, okay, this is great, because them being so small, I just didn't know. You know, when a baby doesn't cry, you're worried, but they were so small, I didn't think that they were gonna cry.
Well, and like one thing that we, previously we talked about, that we were hospitalized because of Adeline. I mean, we didn't know like how Adeline was gonna come out at all. I don't know, just during all that, like, even though like I heard their cries in my mind because I was just struggling so bad, I did not know if I was even like gonna be able to meet my babies.
When they came out, they were, we're talking about the size of a water bottle. Tiny. So
after Daniel was pulled out, they were able to take me off of the gas mask and put me on the nasal cannula because I was able to breathe again. The first thing that I do is I look at Michael and I ask him, how was Adeline?
And I didn't have the heart to tell her the truth, because I knew that everything was going to be okay. But when they pulled out Adeline, she did not cry, and she did not look good. She didn't look like the other babies. So I was
She was limp.
I was worried. I was so worried. Right after I saw Adeline, Hannah looks at me and she says, "How did Adeline look?" And I was just like, she looked great. That was a hard time. I didn't really know, kind of in the moment. And Dr. Sims, the neonatal doctor that was on call that night, came in and he asked us if we wanted to see our babies. And of course, so Hannah is like, my goodness, it still looked like she had been hit by something. I mean, she was like,
oh, that's expressed.
She was looking real crazy. She said yes, and so they had them in incubators and they wheeled them out one by one, just for a few seconds, for Hannah to be able to see the babies. And Adeline was doing well and was okay. Then I actually followed the babies. I wheeled them to their very first NICU room, and they took care of Hannah and sewed her up, and I mean, the rest is history. The babies were doing well. They put them in 2 separate rooms because they didn't have a quad room. They had triplet rooms, but they were in 2 separate rooms, right adjacent to one another, right side by side, and then we had to tend to Mama.
I just remember specifically like them. And look, if you've had a C-section, power to you, Mama, because what they do to you after you have a C-section is brutal. Every single time this post-op nurse came in, she would have to press on my stomach, y'all.
Lord.
And I was like, and then she would ask me what my pain was.
My goodness.
And I was like, you realize that you are literally pressing right where you just sutured me up.
Yeah.
And not took 1, not 2, but 4 babies from. And my C-section scar, y'all, is from hip to hip. It's not like a normal little scar. It's completely across.
Yeah.
But so I would always tell her my pain level, and she's like, okay, we're going to give you more pain medicine. So at this point, I'm like so messed up on medicine,
sick
y'all.
And itchy.
Oh man, I think
Not
I scratched
happy.
my nose almost off.
Not
like
happy.
I was so itchy. The only thing I could think about was, when can I see my babies?
Mm-hmm.
And I kept asking them, like, when can I go see them?
I'll never forget it. They get Hannah in a room, and the first thing that she says to the nurse is, "What do I have to do to see my babies?"
Yeah.
And I was like,
we hadn't slept either,
goodness
y'all.
gracious.
This is probably like 24 hours now.
And they were like, "Well, you probably should rest." And she said, "What do I need to do to see my baby?"
And so they told me I had to get up.
Yeah.
I had to get my urinary catheter out, and I was like, I'll pull it out right now.
We wheel her down there, and Hannah actually gets up from the wheelchair.
Yeah.
And the NICU nurses are like, Didn't these babies just get born? Didn't you just give birth to these babies?
I was determined.
They were like, "What are you doing down here?" Man, it was just crazy to see them in those incubators.
Yeah.
And just how small they were.
We're gonna actually show you guys our babies on the day that they were born. They were super duper tiny. I remember telling the nurse that they reminded me of like little baby kittens because I was a vet tech. So, but this was Evelyn.
She was 2 pounds, 10 ounces.
And then this was her twin sister, Adeline.
She was 1 pound, 10.5 ounces.
And this was David.
He was 2 pounds, 3 ounces.
And this was our sweet little Daniel.
And he was 2 pounds, 1 ounce.
They were super teeny tiny, y'all.
Yeah, they were.
That is going to be the end of our birth story. But thank you guys so much for watching. If you haven't, please subscribe, hit the bell. That way you guys are notified. And I believe we are going to do another video kind of linking all of these together about our time in the NICU. We will see y'all soon, and we have some really cool videos coming up. So bye y'all.
Bye.